Morning. We want to get back out to that breaking news in Arvada. The fire at StoreQuest near I-70, not far from Wadsworth. This is video from Sky 9 from earlier showing the flames and all of that smoke. This is again earlier. We have seen that smoke since dissipate and clear out a little bit more as crews continue their work out there.
And these are some of the last views from Sky 9 before they had to move away to refuel. Smoke still clearly visible everywhere. That's something our crews on the scene and anyone who's driven around there probably saw, or at least at the very least smelled. We want to talk about the impacts of that smoke because, as you saw, it spread over a very large area with the help of the winds, too.
That's right. Our 9 News health expert, Dr. Payal Kohli, joins us now. Dr. Kohli, good morning. Thank you for talking about this with us. What can smoke like that and what we're seeing do to a person's health?
Yeah, you know, smoke, particularly city building smoke, is really, really toxic. It has pollutants in it. It has organic compounds in it. It can have chemicals in it. You can have both short-term and long-term health effects. So in the short term, I think we've all felt the effects of smoke. It burns our eyes. It burns the insides of our airways. So we get respiratory irritation. We can have asthma. It can even cause heart attacks and strokes, in fact, because it triggers inflammation inside our body. In the long term, you can actually have chronic effects on your longevity, on your risk for dementia, even on cancer and cardiovascular disease. So we have to think about what might be in that storage unit, what might be burning, because there could be lead, there could be asbestos, there could be toxic compounds, there could be plastics. Carbon monoxide obviously gets liberalized into the air and we breathe it. And as we heard from Chris, there's strong winds today. So we're talking about distances that can travel not just a few miles, but hundreds or thousands of miles if the winds can carry those particular pollutants.
Our crews that were out there this morning, they did have masks with them. Would that have helped them? Should they be wearing it?
So simple surgical masks don't work. They don't filter out the particles. They're too small, but N95 certainly do help. And I would say not just masks, but you cover the other portal as well, which is your eyes. So keeping some sort of barrier protection on your eyes is really important as well.
And what about the firefighters? Of course, they're fully protected with their gear, but they're in the thick of this for hours on end. It's been going on for more than 2 hours at this point.
Yes, and you know, the risk is dependent on the degree of exposure. And if you're talking about the dose that they're getting, they're closest to it and they're inhaling that air and they're doing it day after day after day. So what we know about firefighters, in fact, is very tragic. They have a higher risk of cancer, higher risk of cardiovascular disease, and their life expectancy can be shortened by up to 10 years. So certainly that protective gear helps, but I really do think about our firefighters being a vulnerable population. We also think about our kids who are under 16 because their lungs are still developing. So exposure to this type of smoke can actually trigger risk for asthma, even after many years after the exposure. We think about our elderly patients, right? The ones that have low lung reserve, and I especially think about our pregnant women as well.
I love that you mentioned firefighters because I'm sure that they're going to hear it from their chiefs today, right? Like when you go back, you got to get that bunker gear off. That's why you have a second set of bunker gear now. You got to shower. You got to get that stuff off you as soon as possible because, as you were saying, the carcinogens that can get in there, especially if they've been out there for hours in the thick of it, it can be really detrimental for their health.
It can be, and we're talking about them inhaling these carcinogens, these respiratory irritants, but we're also talking about their cardiovascular system being under stress because they're fight or flight. They're amped up, so their blood pressure goes up from the exposure, but also from the fact that they're having to run around in this kind of stressful situation. So we really do worry about their long-term health risks.
Now, as you and Chris both mentioned, with those stronger winds that we're seeing today, and what we could see from overhead from our CDOT cameras, that smoke is spreading pretty far this morning. For anybody that may not be necessarily in a 2-block radius of this fire, but they're still worried about any impacts, how far out do you need to be worried?
I mean, you could be worried for tens or even hundreds or thousands of miles, depending on how strong those winds are. Now, some of that depends on what particles get aerosolized. Some of that depends on how strong those winds are. Some of that depends on which way they're going, if there's any mountains or anything else blocking it. But what I would say is for everyone in Denver metro area, today is a high-risk period to be outside, especially for somebody who has chronic health conditions, you're older, you're younger. Stay inside. If you go outside, think about that N95. And even inside, keep those windows closed, use your HEPA filter as much as you can.
I had a guest in earlier and he was saying, oh my gosh, I live right by this. The smoke was terrible this morning. Is there a point in time that you should see a doctor if you're coughing too much or anything like that?
Yes, if you start to feel the effects, those eyes are burning, the throat is burning, especially if you have chronic health problems, you may want to call your doctor because there are inhalers, there are medicines that they could give you that could ameliorate those effects. And you certainly don't want to be exercising outside today or doing any of those types of activities out there.
All right, Dr. Kohli, we appreciate the medical advice. Thank you very much this morning. By the way, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Right now, we want to get a check of that win with Chris.